Good morning, I am Quinn,
And I am Danielle Mitchell.
and our presentation is on children with SLI.
Presentation purpose. Understand what is SLI, the characteristics of SLI in children, the prevalence of SLI in children, and their intervention strategies for SLI in reference to parents and or caregivers.
What is an SLI? An SLI is a specific language impairment. It's a condition characterized by extreme difficulty in language acquisitions in the presence of otherwise typical development according to Hanley and Short. Children are developing, but their language acquisition doesn't meet the same standard as their peers. The language learning problems are there, but can be related to a condition. Therefore, clinicians use the term SLI in reference to the children.
The prevalence of SLI. One of the earliest signs that a child may have problems with language is that the first word is used late or that very many additional words are acquired after the first word. And this comes from Reed 2017, page 98. Children with SLI will not all show signs at the same age. According to the text, the prevalence rate of about 7% is known to be the commonly accepted rate. And here we also have a diagram of the normal curve chart, and it shows the standard deviations, the means of the different scores between different children.
Language characteristics. There are several different language characteristics which are the prevalence figures that a child can meet that will identify whether or not the SLI is present. At the age of 18 to 24 months, signs that are maybe some sort of language problem would be absence of the vocabulary growth sprout, failing to combine two words utterances. Sometimes children have the tendency to develop language skills late as they are considered to be late bloomers. And this is by Reed of 2017 on page 98. There are about 10 to 15% of 2-year-old children will fit into this category, also provided by Reed of 2017 on page 98. For example of this, the child is unable to make any two-word utterances such as give me or that's mine. The child will still be communicating with one-word utterances such as mom or hi.
At 3 years of age, signs would consist of showing consistent language difficulties. Also, the child is unable to voice any expressive language. According to text, it suggests that about 20 and 75% of children who were slow in language development were able to basically be deemed as normal language by the age of 3. And this comes from Reed 2017, page 98. For example, the child's vocabulary will not be expanding. The child will not be able to make any progression towards making sentences. At 4 years of age, according to text, a 4-year-old with an SLI would be functioning on a 2-year-old language level if there was an SLI present.
According to the text, approximately 45 to 85% of 2-year-olds with the SLELD receive scores within normal limits on measure of expressive language at 4 years of age. When children are 4 years of age, how their language is developed will usually be able to demonstrate how their learning will be in the future. For example, if a child has a problem with being able to interpret low reading skills and or narrative skills, their extent of comprehension as they become older may be delayed also.
At 5 years of age, according to text from the results of a study by Whitehurst, Fischel, etc., 1991, 5-year-olds who had been slow in their early expressive, but not obviously in their receptive language development, evidence expressive vocabulary performances, and general verbal fluency skills that were not notably different from normally developing 5 years old. This comes from Reed 2017, page 100. And an example of this would be by this age, if a child is continuing to demonstrate problems with following directions, struggling to learn more words, or even being able to make conversation amongst family and peers, Those are some potential signs of the child having an SLI.
Intervention strategies for parents and or caregivers. And there are two types, which are indirect intervention and direct intervention. But on indirect intervention, it is provided by professional interventions with the child. It is also mandated by the federal law, and being that the child spends the most time with the parents and or caregivers, it is very important. And there are two main objects of this intervention.
Intervention strategies for parents and or caregivers. The first strategy is creating or enhancing the child's environment to facilitate change in the child's language. Parent recognize and take advantage of the language learning opportunities that occurs in a child's daily activities. The second objective is responds within the environment in a manner that optimally facilitates language change. For example, this strategy can be used during dressing, interactive play, meal and or snack time, story time, daily activities, etc. That had focus on subject and or specific action, object, or event.
The presentation conclusion. Overall, this presentation was given to ensure that the parents were educated on ways to cope with the child that has been diagnosed with SLI. Each stage that was discussed is noted to be a prevalence figure as where the child performance should be at the coinciding at age. There are also various of interventions presented so that the parent will be well aware of how the SLI may affect the child's daily activities.
Reference page. We obtained all of our information from the book, An Introduction to Children with Language Disorder, and this book is by Vicki Reed, wrote in 2017 and published by Pearson. Also, we retrieved information from a website entitled National Institute on Deafness and Other Communication Disorders, and this was in the USA. And we have also attached the link to this website.
Questions and answers.
If my child receives early treatment during preschool, will this help my child's SLI?
Yes, the earlier the treatment can help the child, although there still may be some learning difficulties throughout the child's life.
When does SLI first appear?
Signs and symptoms of SLI usually appears in the child's early life, which is like between 18 to 24 months.
How can SLI be diagnosed?
SLI can be diagnosed by the exerting of a series of standard tests, interviews, or direct observations of the child.
Thank you for watching the presentation. I'm signing out, Danielle Mitchell and
Quneissanna. Thank y'all so much for watching.
Goodbye.
Goodbye.